Hello, everyone from 8105. Thank you for taking the time to listen to my talk on my argument for my final paper. I look forward to your comments and feedback. To give you some context on my topic, literature describes that even though phenomenology has been used since the 1980s in nursing, it's not a widely used approach in health professions education because of its philosophical and methodological complexities. And these complexities often prevent researchers from engaging in phenomenology appropriately or at all. My argument is that although there are practical limitations to using phenomenology in research, the benefits of its use in health professions education outweigh these limitations. This pyramid, which I have created, depicts my arguments within my paper. It shows that the complexities associated with phenomenology are practical ones and can be broken down into parts that can help guide researchers in the use of phenomenology. The first part, the foundation, is important that the researcher does this so that they can use phenomenology to its full potential. It requires researchers to align the purpose of their study with the appropriate stream of phenomenology. And then they are able to invest time in trying to understand the philosophy associated with their stream. So then they can engage better with the methods and understand complex terms such as reduction and imaginative variation and how this relates to the philosophy of their stream. So overall, this pyramid aims to convert some of the methodological and philosophical complexities into practical parts that can help guide researchers in how to approach phenomenological work with more confidence. Because as it has been described in the literature, it's not until a researcher practices phenomenology that they can really begin to understand the process itself. And I argue that it is worth the time and the effort that it takes for researchers to engage in phenomenology, because phenomenology brings new insights and ideas into often unstudied realms of healthcare. As Hooker and colleagues describe, phenomenology brings research beyond what a phenomenon is, but how it is experienced. And this allows researchers to identify essential elements of phenomenon that we can then act upon to inform changes in curricula, evidence-based practice, and best practice standards. Also, phenomenology supports a holistic approach to care, and given that patient-centered care is at the heart of healthcare today, Gale talks about how phenomenology can move us away from these ready-made models of care and really give patients a voice in their own care and informing change. So in conclusion, I have outlined that the limitations of using phenomenology in research are practical ones, but are worth overcoming for the advancement of health professions education. Thank you for listening.